When I was a young faculty, there was an opportunity to build a new program at the University of Illinois to cure type 1 diabetes. That excited me tremendously. I worked very hard, working long hours, Saturdays, Sundays, didn't matter, because I loved it. I became the director for pancreas and islet cell transplant program there. I had the greatest opportunities to write an IND to FDA about a new way treating people. So I had my second child when I started as an assistant professor of medicine, and my boy was born with a heart disease and was diagnosed at 18 months old with severe autism. We had to move to a place where he can get a better care, which meant we left all that we built in Chicago behind to start over again at Cleveland. When I decided to move to University Hospital, it was about building a new center with Case Western Reserve and University Hospitals, a diabetes center. And that was such an excitement to be able to build from scratch once more. When I started working on building this new center and realized that I had this support of the leadership, that allowed me to revisit how to reshape the models we have today to take care of patients, because current model is failing.
The secret of great care is love. Love is this energy that is in all of us and connects us all. We're born with it. We don't need to do anything to deserve it. And when we leverage that power of love within and between people, we improve and learn faster, better, and cheaper.
I've created a program here at University Hospitals that is an interesting model. I see patients one-on-one, as well as among their peers, people who are struggling with obesity just like they are. I have them see a registered dietitian who herself had struggled with weight as well. I also have them see a psychologist if necessary, and we try to tackle their obesity problem in a multidisciplinary approach. I'm finding that patients are very satisfied with this approach and are ultimately improving their quality of life as well as their medical problems.
We observe these magical moments in individuals that their life totally transformed by just us being there and giving them that opportunity and touching their hearts. Our patients constantly reminds us what a blessing that is.
Diabetes is one of the major diseases that are still uncurable in this country. And we have an obesity epidemic which exacerbates the issues of diabetes. What's remarkable for us here at the School of Medicine is that we network with Metro Health, University Hospitals, Cleveland Clinic to offer a unified approach to medical education and research, benefiting our major hospitals in the city.
One thing that is really lacking in a lot of research is research isn't necessarily developed to meet the needs of the community. And when you're not meeting the needs of the community, then how are you going to develop sustainable research that's really impactful for their diabetes self-management? I noticed that the diabetes community and some of my patients were really experiencing issues accessing insulin and feeling really stressed about the cost of diabetes. We're working with a community advisory board and a national nonprofit organization, the Diabetes Link, and we developed a health insurance and financial stress toolkit over the past year, and we are now testing it in a randomized control trial nationwide, and we are hoping that at least half of the sample will be racially or ethnically diverse, and half of our sample will be on Medicaid or uninsured, and we're really hoping to improve self-management outcomes in these populations.
Fundamentally, it's all about building trust, building self-efficacy, and building hope. And we are going to change the world when we see the humanity and the love in every human being, and then leverage that to innovate faster, to improve faster, so that we solve these problems and make care better for the patients that we're so blessed to serve.
My life story is about resilience, not losing hope. If you're down, you can just stand up back again. It's about not losing your focus, but also being flexible within it. You have to somewhat believe there is a story that you are writing together with life that you should really follow with joy.